So these are my big issues regarding vaccines, and these are the things that I'd like to highlight. Number one, there is no education in medical schools that I am aware of, and being an educator at the Cleveland Clinic Lerner College of Medicine and Case Western Reserve University, I am not aware of education around vaccines, their contents, safety records, informed consent, or the Vaccine Injury Compensation Program. We do not discuss that in 1986, Congress enacted legislation removing all liability from pharma related to vaccine adverse events. What are we taught about vaccines? We are taught to memorize the vaccine schedule. And actually, I'm going to be sitting for my family medicine boards this year, and I am sure that I will have to memorize that schedule again in order to pass that exam. We don't discuss that almost $4 billion with a B has been paid to vaccine-injured patients since 1992. For medical professionals, we expect fair balance, but vaccines seem to be absolved from that consideration. Number two, there appears to be a conflict of interest regarding payments to providers for completing vaccine schedules. And a corollary to that, which would be number three, patients are being dismissed from practices because of, quote unquote, vaccine safety concerns. If you bring up a question about a vaccine and you decide not to vaccinate your child, you may be at risk of being terminated from that practice. Absolutely deplorable and disgusting. Number four, and again to the Bailey family, I'm really sorry, but employers are forcing employees to receive the flu vaccine or face corrective action or job loss. And the fact that your dad was 6 months from retiring is... Number five, there's a lack of informed consent, and I was one of those providers who didn't provide safety sheets before vaccinating. I would tell the parents, these are the vaccines today. We're going to give you 3 vaccines in one leg and 2 in the other. And then after vaccinating either the child or the adult patient, here's your information sheet. And again, to be completely transparent with you, I had no idea that there was even a mention of the compensation program or a telephone number to call. Absolutely deplorable on my part, and I apologize to my patients. Number 6, there's a lack of transparency regarding vaccine complications. And worse, you're being shamed as patients for suggesting that you were harmed by a vaccine. If I see a patient in the office and diagnose strep throat and give them penicillin, and either the mom or the patient themselves calls and tells me that they developed a rash, there is zero question. The chart now states they have an allergy to penicillin and will never be given it again. Why don't we believe parents and patients when they tell us they have had an adverse event regarding a vaccine? It doesn't make sense to me as a medical professional. I apologize for being emotional. Number 7, actually I don't apologize. Number 7, thank you. Why do the placebos in vaccine studies contain the adjuvants like mercury and aluminum? Aren't placebos supposed to be inert? In other words, if you're comparing, let's say, the hepatitis B vaccine against the placebo, why does the placebo contain a metal? If the concern could possibly be the metal itself that's triggering the autoimmunity that Dr. Lyons-Weiler had so eloquently spoke about. Number 8, why has the rate of autism spectrum disorder gone from 1 in 1,000 in 1990, as I was taught, to 1 in 48 in 2017? And is there a link between the toxins in vaccines and this significant increase in the diagnosis, not only of ASD, we certainly know about a risk of Guillain-Barré, but what about attention deficit disorder, mood disorders in children, and just the overall chronic disease epidemic in this country? I mean, we are a very sick population, and I'm not trying to be dramatic, but we're currently spending $3.5 trillion on healthcare. And what, honestly, folks, are we getting for that? We're expected to see, right now we're at 18% of GDP is spent on healthcare. So basically 18 cents on every dollar that we bring in is spent on healthcare. By 2040, that is expected to be 33%. I'll repeat that. By 2040, in 22 years, we will spend 33% of our GDP on healthcare. That makes it unsustainable in our country. Why? Because 66% of every dollar that's brought in, or 66% of our GDP, is already accounted for with Social Security, Medicare, Medicaid, and the VA. So if we already have 66% accounted for and then 33% added to it with healthcare for the rest of us, what does that leave for education, defense, infrastructure? You get the idea. The United States becomes unsustainable if we continue down this path. So let me focus just a few minutes on informed consent. I want to make sure that my patients and all patients are fully aware of risks versus the benefits before undergoing any medical procedure, not just vaccination. Nobody should have to undergo an irreversible medical procedure unless they agree to it. And patients should not be dismissed from practices for choosing to decline a vaccine that's irresponsible on the part of the medical professionals. We need to take care of all patients, not just select few that agree with our position than any medical concept. Employees should not have to receive a medical intervention in order to keep their job. And the big question that I have is, why are we not protected under the Geneva Convention? After World War II, and we all recognize the atrocities that the Germans imposed on patients in concentration camps, the United States was one of the countries that agreed to the Geneva Convention, which stated that no human being should undergo a medical intervention without their consent. So to me, the idea of forcing a medical intervention on someone without their consent goes dramatically against the Geneva Convention. And to me, moves to the point that it's an incredibly slippery slope, folks. Are women going to be forced to undergo a mammogram or a pap smear in order to keep their jobs? Are men going to be dismissed from medical practices because they refuse a digital rectal exam or a PSA for prostate cancer screening, or a colonoscopy at age 50 for screening for colon cancer? Where does it begin and where does it end? And where does just overall government and employer interference regarding our protections under the Constitution begin and end? All medical professionals should be fighting as advocates for their patients, not just myself or people who are represented here. As a physician, and all physicians, we take the Hippocratic Oath and we say, no primum nocere, first do no harm. And not providing informed consent regarding a vaccine and then ultimately discovering patients had adverse reactions to that intervention is a direct violation of that oath.